Thank you, Stephen. Every night at 6 p.m., we are taking you deeper into the impact of the coronavirus. Tonight, I am joined by Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital. Thank you so much for being with us tonight.
Oh, thank you, Naza.
We just got a look at the mall. A lot of stores are now making the decision to wait until the weekend to reopen. What are your thoughts on the safer at home order?
You know, I was really hoping they should have had delayed a little bit of that, at least 2 more weeks, but now it's already set to go. I think we need to remember the rules is going to be the same about physical distancing is very important, at least 6 feet apart if possible. Hand hygiene is essential. And then in the stores, they need to pay attention to occupancy of these areas. They really need to pay good attention to their employee as well as who's visiting to have that physical distance. The other part, if you're sick, please stay home. Don't go out because you might cause infection to others.
Really important as we make this transition to remember all the rules are in place, as you said, and to continue to be mindful of them. In your opinion, what are the keys to finally reopening Alabama?
I think the essential keys, which have been highlighted multiple times, is one would be reduction in the cases of coronavirus in the state, and I would say in the surrounding areas as well, in addition to the wide availability of testing, and then continuous reduction of patients, whether hospitalized or in the community. And that's why my main thought was, hopefully there will be a little bit of delay, but I think in general Madison County been doing well in the number of cases, and it's been really stable. The main worry is the other surrounding counties there.
Certainly, because someone can just cross over and attend a location in another nearby city and then spread the virus. What would you like to see happen before restaurants and salons can finally reopen?
I really hope in that part we continue to see significant decline in the cases, and at the same time our ability to trace and track all the cases in a way, so if we get any exposure, whether in a restaurant or in a shop, we can go back and try to track whoever got exposed. And that's really essential, so we can, in a way, able to quarantine them, but at the same time, you know, reduce the chances of widespread infection. That's very, very important.
And in terms of finally reopening Alabama, when do you project a timeline for that, in your opinion?
This is probably going to be another 2 to 4 weeks. As you see a reduction in numbers of cases, I think the next few weeks are going to be very important because, you know, the virus, if it causes an infection, it takes about 7 days of incubation period and another few more days for symptoms and signs. So if we're really going to see any increase in numbers, it's going to be another 10 to 14 days, and it could be 2 to 3 weeks even. And that's going to be an essential time where we'll tell, no, we're seeing reduction, or we see an increase, and we're going to need to be hold on of not releasing more rules about rest, relax in that case.
We have been hearing a lot about remdesivir. What makes this drug special?
So remdesivir, you know, been used before and tried for Ebola, been tried for the SARS, as well as the MERS, which is another type of coronaviruses. The hope it's going to have a benefit in COVID-19 patients. You know, there is some reports yesterday in the news about possibility of benefit, but I can tell you I'll be really cautiously optimistic about this because there hasn't been a full release of the information about that study in the NIH. So we really need to be waiting to see the full report so clinicians, scientists, and researchers can have a look at that and assess, is it beneficial, how far, is it going to be effective for everyone or certain population infected? Because on the other hand, there's been some report from remdesivir might not be as effective. So we need to be really careful about interpreting what's coming up in the news. We need to see the full information before we make a judgment.
So we can remain optimistic, but we do just need to wait and see at this point. But why, in your opinion, does this medicine seem to be seeing more results?
I think it's mainly because it's been shown it have some effect on the virus in general, including the coronaviruses, different species, and there is hope it might have effect on the specific COVID patient. Because it has specific antiviral activity, and compared to other medicine we've been trying, all the other medicine might have shown possibility, but is not as, what remdesivir is showing. So remdesivir is getting to be more unique in that part because of its antiviral activity.
And Huntsville Hospital saying just today that some of its patients who were given the drug reduced their hospital stay to 11 days from 14. So do we know yet if fewer people are actually dying? Is it saving lives, or is it just basically cutting down on time in the hospital?
So at the moment, this is from the NIH news more. There's possibility it cut down on hospitalization, but the mortality rate between those who took the real drug versus the placebo, what we call, was not statistically significant. It made a little bit of a difference, but it wasn't a significant change between the two. Again, that's why we're saying we really need the full information to get a better idea. Is it really effective, and is it just severe cases? Is it mild, moderate? All these information, unfortunately, we don't have it yet.
Do we know yet if the drug will be used on, for say, patients in ICU?
And that's what the NIH trial was, those who were in the ICU but not intubated. There is other ongoing trial for those intubated. There's others for mild to moderate. So there's a lot of stuff ongoing as research. And we really, again, you hope by the end of May, sometime in June, we might have a little bit better information on some of these trials.
Early on, there was a lot of promise, or at least it looked as though there would be, on hydroxychloroquine. Is it too early to know if the drug is going to have some of the same issues?
I think it's a little bit early. There was early report of possible issues of side effect, toxicity, but in that NIH trial, again, we didn't have that information. Usually, the safety board of any trial will assess that on multiple stages. So it might be a little bit assuring. We haven't heard from yet there is a major safety events, but minor ones, it could be happening. And again, this is going to take time, at least several months till we know is it really safe, because as you know, when you run trials, you can have some safety events, but what's going to happen is when it really got used in our patients to know if there is really major issues or not.